Okay, so today we're going to be talking about Parkinson's disease. And this kind of hit home because my grandparents suffered from Parkinson's disease. Parkinson's disease is a progressive disorder. So it will affect movement. It will affect, for example, like hand tremors, your speech, the way you, for people that suffer from this, it will be affecting their whole lives in terms of physical movements and processes. So, Parkinson's disease, it can be seen to cause hand tremors, slow movements, rigid muscles, stiffness, especially during walking, inability to perform certain movements, so the person will not, obviously not be as elastic as or flexible. More likely, it's a better word. More flexible as before. This disease mostly affects this neurological disease mostly affects older people. So risk factors will be increased age, your genes, your sexuality. Also, like most of the time it affects men more than women. So men have a higher risk to develop Parkinson's disease. Also, the exposure to different settings can also increase risk for Parkinson's disease. Being in a job that exposes you to different toxicities or chemicals are also higher risk. But I kind of went out of track. Parkinson's disease is caused by basically neuron death. So the nerve cells, actually, well, the cells in your brain, they're called neurons. Those die, and as mostly in specific areas of your brain, as those neurons die, the dopamine production levels will decrease. Dopamine is a hormone that aids in the signaling of movement. So as the dope, also as other things, of course, as dopamine levels decrease, there's abnormal brain functions, abnormal, like the ability for your brain to function in all of its jobs will be inhibited, and this can be seen as a inability to move in Parkinson's patients. Complications, for example, it can be, as I said, like eating, so swallowing properly, chewing, eating problems, sleep deprivation due to inability to breathe, bladder problems, constipations, like blood pressure changes, fatigue, and pain. Because there's pain if you can't move your body. Um, this disease is a tricky one for doctors, especially because it cannot be diagnosed. Well, it can be diagnosed, but it doesn't have a telltale sign that says, okay, this is Parkinson's disease. For doctors, they most of the time they use ultrasounds of the brain. They use PET scans. They use CT scans, MRI scans, all of these different tests to rule out the possibilities for other diseases. And if those are all ruled out, they end up with Parkinson's disease. It is not easy to localize, and it's not easy to treat because there isn't a cure for Parkinson's disease. It There's obviously medications because of the low levels of dopamine. The medications that Parkinson's patients receive have levels of dopamine, and the doctors will most probably tell them to stay active, to try and move around, do aerobic exercises, or in some cases like balancing exercises or stretching exercises to try and recover along with the medication some of the dopamine levels that they need to be able to live an easier life, because like this disease can it makes life very difficult. Some examples of medications can be dopamine agonist, MAOB inhibitors. There's different kinds of inhibitors. There's COMT inhibitors and anticholinergics. So all these medications, like for many years, have been used to help the tremors of the patients. And but there's a new one that is a surgical procedure that's called a deep brain stimulation. So what the surgeons do is they open the patient up, and this is very expensive, of course. But they implant electrodes in the brain, and then those electrodes are connected to a generator that is going to be located around the chest area, or it's going to be like around the clavicle area. And the generator sends electrical impulses to the brain, and these apparently have been seen to help reduce Parkinson's disease symptoms. It is not, of course, it's not perfectly proven because there haven't been that many tests for it. But there's hope, and there's people working to help this this disease that affects so many people every year. Um, Prevention, there isn't really a way to know what causes Parkinson's except for the risk factors and everything. There isn't really a way to prevent it. I mean, you might as well just. I mean, it's honestly just bad luck if you have Parkinson's. The most you can do is decrease the risk factors. You can't, like, if you're a man, be decrease the amount of time that you're exposed to chemicals, decrease the level of stress at your job. There isn't really, maintain a healthy diet, get enough sleep. Don't drink as much caffeine, which is a problem for our college students. But Parkinson's disease is just one of those mysteries, and unfortunately, it might be still a long time until we find a cure for it, or maybe a way to completely be able to prevent it for future generations. But that's it.